Good afternoon, everybody. Welcome to this week's Facebook Live on the COVID response. My name is Justin Westmiller, the Director for Homeland Security and Emergency Management here in the county. And today with us, we have Dr. Annette Mercatante, the St. Clair County Medical Health Officer at the Health Department. So welcome,
Still
Doc.
here.
Still here.
We're still here. Hope you are all doing all right, too. Let's get started with the data.
Get right to it. All right, totals to date, 8,011 total cases, 452 people hospitalized, 200 deaths, and 5,460 recovered. Changes in the last 7 days, we have 208 new cases, and we're averaging 29.7 new cases per day, with an average number of 331 tests per day. And currently, we're seeing a 9.4% positive on those tests, which is down a little bit from the last couple of weeks. So we're continuing on a downward trend. As I stated, here's the trend graph for positive cases, and we're in the 30s now, or we're close to the 30s, just below 30, which is far better than we have been in the last couple months. This is our percent positivity. It just shows you right there we're just below 10%, and that's kind of where we've been tracking the last couple of weeks. Finally, St. Clair County has received 9,925 doses of vaccine, and we've put 7,110 into arms. And the state, obviously, is it's about 3/4. So, all right, yeah, I'm sorry, it's half. All right, so this is our dashboard link. It's live all the time, and you can go there for the up-to-date information as you see fit.
So I'll just kind of add, as our cases are down, our hospital emergency use utilization for COVID-related illnesses is also down. Less than, what did you say, 20% of our beds are now COVID-related? 13%. So that's coming down very nicely. Plenty of hospital capacity. So we're on the other side of this last wave, which is a huge sigh of relief. That doesn't mean we can let our guard down, but it does mean that we have a little bit more capacity in our hospital systems, and a little more capacity now to do what we've been doing with the vaccine. So that's all good news.
All right. Is everybody
ready?
Yep. Let's do it, Jen.
All right, let's go. Dr. Mercatante, can you talk about St. Clair County's, our current vaccination plan, what we're doing right now, what groups?
So this is the state announced, as you recall, a couple weeks ago, that everyone over 65 is eligible to receive vaccine. Prior to that, we were doing the 1A, which is the essential healthcare workers. And also with this eligibility now is the 1B, which is the essential workforce outside of the healthcare industry. So we do have in that group our teachers, our firefighters, really even some of the county workers, our court systems, really all the systems in place where people, if they don't show up for work, we have a difficult time running our community. And people that work from home don't necessarily count for this. We want to focus on the people who really have to do their job from in a public environment where they have to be exposed to other people. So those are our eligibility groups. We, as you know, do not have enough vaccine to provide everyone vaccine in those groups that want them. It's certainly not right off the bat. So we are allocating what we receive each week from the state, a percentage of that to the 1A, 1B closed private vaccination clinics, and we're allocating a portion of that to the 65 and older vaccination clinics. So we just kind of keep working away at both of those sides, and it is a first come, first serve type of situation. That means that you need an appointment to get a vaccine, and to get an appointment, you have to be able to log into our website and schedule that through that online Acuity scheduler. We are looking at ways for phone calls to be taken. Please stay tuned. We're almost there. And we also know that people have to, have other ways of getting into that schedule. So working on that. And I know this is going to come up, but the idea of there's no waiting list yet. Apparently Myers has a waiting list and McLaren has a waiting list. Everyone's got a waiting list but us. We're going to work on getting a waiting list. The problem is we want a waiting list to be functional. So if I collect 19,000 names on a waiting list and it doesn't help me get any more people into their clinics, then it doesn't really, it's just a whole lot of extra work without it really being very functional. So we're looking very seriously at the different options we have. Health departments across the state are all doing different things, all with varying amounts of success and maybe not so much success. So please stay tuned and we'll get back to you about that. So I think that's about it. I kind of probably said more than I was supposed to about our current vaccination plan.
Okay.
I should let me go over this one more time though for people to understand though. So we cannot order vaccine from a manufacturing company. Okay, we have to receive our vaccine through the state's stockpile, and the state allocates that based on all the different things going on up there with them. And so we might ask for 3,000 doses of a vaccine, and we may get, as in the case of this past week, we get 800 instead. We may ask for Pfizer, and we may get Moderna instead, or vice versa. So it's very uncertain, which is another reason why we can't schedule those clinics until Fridays when we know what vaccine we're actually getting. We can't schedule clinics without product, right? I don't want you to show up and have nothing to give you. So that's part of this kind of, one day at a time thing. And I fully expect this will get better over the next several weeks to months. Okay. Sorry.
No problem. Justin, maybe you can talk about, we've had some situations where people are coming to the clinic without an appointment or expecting that they can come if they've been hearing if there's extra doses. Can you talk about how that's not the plan at this time?
Yeah, so there's a couple issues with that. One, we are scheduling as many doses as we know we have per day. If we come up with a couple of extra doses, they will be added to a future clinic. But we are not doing any walk-up vaccinations right now. It's just not a viable option. There's potential security issues. There's potential just no vaccine available for those that may walk up. So we're working really hard to continue to keep it scheduled. And if we're going to have walk-up clinics later on, we will let you know.
Okay. Dr. Mercatante, if you had both shots and are exposed, do you have to quarantine?
That's a great question. And the official answer is right now, the advice is yes, but there's a lot of discussion about this. We expect the CDC to be releasing some new guidelines at the end of this month, I believe is what I've been hearing. Because let's face it, if you've had a natural infection, we don't require quarantine within the first 90 days. And we expect the vaccine to be more protective, hopefully, than a natural infection. So I think those guidelines might change. But right now, the answer is yes.
Okay. Justin, why are children not being vaccinated in our school districts before returning in person?
Yeah, so the previous testing of the two vaccines that we have approved under an emergency use authorization were tested. Pfizer was tested 16 and up, and Moderna was tested 18 and up. So there is a potential for those 16 and older to get a vaccine at the appropriate time. But anybody below the age of 16, we all have to wait until both of those companies and other companies do further testing to find out what the impacts are to those vaccines with that age group.
Okay. Dr. Mercatante, what time exactly does registration open for vaccines on Fridays?
I love that question. It's a very honest question. And my very honest answer is I can't tell you. We don't know. Again, let's go through the process. We we order our vaccine on Wednesdays. We receive from the state on Friday how much vaccine they've decided to send us, if any, I might add. And in that situation, that notification we expect to have in the morning. This last week, we didn't get it until early afternoon. We cannot schedule the clinics until we know how much vaccine we have. And scheduling those clinics is a process, right? It's not like we just push buttons. There's somebody, we have to have staff like physically do that, and then we got to send the links out. So the answer is sometime between no sooner than 2 o'clock, I would say, and no later than 4 on most days, on a good day. There might be a day where we get allocations very, very late and we'll be working after hours, but we do tend to like to wrap up by 4:30, 5 o'clock. So I would say 4 o'clock at the latest until things change.
All right. And normally it's on Fridays, just so everybody knows.
For now, it'll be on Fridays. Yes.
Yes. So, Doc, speaking of working, somebody wrote, I'm not convinced that the health department is being proactive as possible. For example, why aren't you working on Saturdays? Isn't this a pandemic?
Yeah, well, we're prepared to work on Saturdays. We've been able to utilize all of our vaccine during working hours, to be honest with you. I think when we get more vaccine, you're going to see weekend clinics. We can't run a clinic without vaccine. And by Thursday, Friday, whenever the schedules are done, we're done with it. We don't have any more vaccine to deliver. So it's a great comment. I understand that, but when we have enough vaccine to do that, we will.
Okay.
Yeah, as a matter of fact, if I can just jump in there too, Jen, we have a list of volunteers that are ready to help us do things like work after hours and work on the weekends. We are ready and able to do far more right now than we have available to us. So that's just part of how it's going right now. And we're just asking people to just be a little patient. We expect things to open up a little more in the coming weeks and months. And I know it's frustrating, but that's the answer right now.
I just wanted to put a sidebar in too, that probably since March, many of us have been working 7 days a week, right? So doing case investigation and everything else. So
yeah,
we have been working a lot. Okay. Next question, Justin. This person, 58 years old, severely obese, and their wife works in a convenience store. When can we be expected to be vaccinated?
So they're in what's called 1C Group B. So there's groups in every phase, and that's what we're dealing with. So I would expect somewhere around May-ish of 2021 that we will start being able to hit that group. We're continuing to work through the 65 and older right now. We're working through the teachers. We're still working through our 1A folks. We do have some medical provider and medical staff that still need to get their vaccine. So there's a lot of groups we're working with and very little vaccine. So the promise I can make to our entire community is that the moment that we have access to more vaccine, we will be reaching many more of you.
Okay. All right. Next question. When will vaccines be available for all or other essential workers in the area?
Well, that's kind of the discussion that Justin's having. So as we get vaccine, we push it out. We're trying not to play good guy, bad guy. This one's good, this one's bad. We're trying to really make those assessments on the job they're doing. There's a long list of essential workers. Of course, everybody believes their workers are essential, and let's face it, honestly, they are. The person that works in a restaurant or a convenience store is pretty essential. So I would say we're just going to keep expanding and expanding as we get through different groups, and we get vaccine. We can just keep expanding that to the workforce.
Yeah, and if I
so
could
that
add
doesn't
one more
answer your
thing.
question when. We're talking weeks to months.
And months, yeah. And the last thing I just want to say about this is I've been in contact quite a bit with the state emergency management folks, and they are ready and willing to provide state-supported mass vaccine clinics as soon as we have enough vaccine to do so and it's worthwhile. So we will be going through every avenue to make sure that we get all 170,000 people in our county vaccinated appropriately.
All right. Next question. My father and mother-in-law are having a hard time finding somewhere to get vaccinated. Is there a best time to call to make an appointment?
No, there's not enough vaccine for everybody who wants it. So my advice at this time is to use our website on Friday afternoons. As soon as we have other available like phone lines to call and a waiting list, we'll let people know, we'll get people on the list, and we'll try and go through that way. But right now there's really no best way. You're not missing out on something. It's just not there. So patience is the pillar. I read this today. The pillar of this whole campaign is going to be patience, because we're all going to be doing a lot of waiting until we get there. We've waited a long time. It's not what we want to hear, because it's been a long, long year, but we do have to wait longer. These days, these vaccines can only be manufactured so quickly, and quite honestly, it's kind of out of our control. Justin and I are working tirelessly to find vaccine. It's not like we can go somewhere and buy it. It's just not available to us. So we are going to have to just keep telling you guys where to go, and we'll get there. I'm going to say this again. We will get to you. I promise you, we will get to you, but you're going to have to be patient.
Yeah. Okay. Two more questions, and you kind of already covered this, but people want to know what time should they be looking on the website tomorrow. And again, you mentioned no earlier than 2 and probably no later than 4. How long after the second vaccine is given is a person considered protected?
10 to 14 days.
Okay. When will
Jen, I'm sorry, go
can you
ahead.
hear me? When will 65 and under with underlying medical conditions be eligible for vaccines?
When we have enough vaccine.
Okay.
Yeah.
Somebody
I wish
said,
I could be more specific to that. I really am. I saw a timeline today on somebody's slide set, and it looked like they were anticipating more vaccine products to be approved in March. So Johnson & Johnson and the AstraZeneca look like they're online to get approved in March. If that's the case, we could see some nice influx of vaccine with those as well. So perhaps March, but I'm not saying for sure.
And one thing I want to add to that too is just today, the president basically allowed all the states to utilize the National Guard at full 100% refund by the federal government, which is really good news, because there used to be a cost share. So that's just another resource, and I am probably approached once a week to utilize those folks when it's proper. So we're ready to pull that trigger too.
okay.
Yeah, the problem is not that we don't have the capacity to vaccinate a lot of people. We have lots of options. The problem is we don't have the vaccine.
Yeah.
Right.
Okay.
Jen, there's one on there that I'd like to talk to, if I might, where the gentleman talks about the 99.7 survival rate. So I sent out on my Facebook site the other day an actual breakdown of survival rates by age range, and that may be the survival rate for the lower groups, like the 16 to 38 or 40. But the higher you get, the older you get, the more impactful this is. And on that site, you'll see 65 and over is around 5%. That's an awful lot of people to lose and still claim we're at a 99.7 survival rate. So I just want to make sure that we're clear. Feel free to read that too. But that it was very impactful to me, and it's easy information to get.
Yeah, I just checked with Brandon, the guy who keeps track of all of our local data, and our St. Clair County mortality rate is close to 2%, 1.8%. Okay, so I don't know. Yeah, you're right. You can't really break this down into saying there's a 1% mortality rate. You got to look at what groups you're talking about. Not to mention, even if that's all that died, say that was all that died. This disease is a kicker. If
Yeah.
you are unfortunate to be in that 10 or 15% group who gets really sick from this, even if you're not hospitalized, I can tell you, you are sick and you're not functional, and the ramifications are very long-lasting fatigue, shortness of breath. Many of us post-COVID, I've talked to many of you, and myself included, feel like you almost need rehab to get started. In fact, we know of individuals in the workforce who are actually going through rehab just so they can get back to work. This is not a nothing. So we're not gonna argue that point. Go back and look at the national state data, and you can see that we have to continue to take this very seriously.
Yeah, like I was saying in that readout that I put on my Facebook, 15, and this is from an epidemiologist in the state, 15 to 30% of the COVID patients are seeing long-term impacts. So yeah, you might survive from it, but you might have heart disease, lung issues, circulatory issues, etc. So this is something to keep our eyes on and make sure we make it all the way to the end on this.
Someone asked if it's going to be required if you want to fly on a plane to be vaccinated. Is that true or false?
So the real answer to that is nothing like that's been announced yet. But each company, each aviation company, can make their own rules and require their own things because they're a private business. I would expect that they wouldn't potentially do that until it's fully authorized and comes out of an EUA. But it remains to be seen how that's going to work airline to airline and like cruise ship organization or company to company. There may be something that happens there, but it's too early to tell right now.
Okay.
Yeah, I don't think we're going to see any mandated vaccines for the coming year. There's just too much variables. But long term, if we find very safe, effective vaccines, and it makes the difference between your workforce being intact or you having large outbreaks of COVID in your clientele, I could see how businesses might consider that. So it's something to keep your eye on.
I just wanted to just share something. I don't know, Justin, if you can see it from where you're at, but one of our viewers today said that her mom lost her battle to COVID last night. So we just wanted to share our sympathies with her.
It's horrible.
Absolutely.
It's a horrible disease. Yeah. It's absolutely. And not only are they dying from it, but you can't go and see them. So my best friend's dad is got COVID, was hospitalized, and he's 96, so he's in a nursing home. They can't even they can't touch him. They can't go and see him, and it's just heartbreaking for everyone involved. So my condolences to you. I'm sorry to hear.
Yeah, Angela, we're certainly all thinking about you and your entire family, and it's rough. We hate it.
So we have, I did bring up, it's a good point, maybe to talk about our death rates, because we've been tracking, we're over 200 now. We've had 200 deaths in St. Clair County from COVID, which means there's probably a whole bunch more that we don't know are COVID related. And I had Brandon take a look at what our death rates are from other diseases and non-COVID years. And COVID deaths now are ranking between the third and fourth most common causes of death in our county, between unintentional injuries and respiratory diseases. Nationwide, I think COVID's ranking even higher as a cause of death. The two most common causes of death are cardiovascular disease and cancers. So just imagine that this one little viral infection is now ranking anywhere from third to maybe even higher as a cause of death. It's pretty astounding. A lot of pain and suffering out there, people. Okay.
Next question. Has there been any thoughts on sending a nurse out with the Meals on Wheels volunteers to administer the vaccine to those who are homebound?
Yeah, I think it would be a great plan. Those are all plans that we have in our back pocket waiting to get vaccine.
Yeah, and we can expand on that a little too, Jen, where, we've learned that right now it's not recommended that those vaccines travel once the vial's been punctured. So we're still working with, by we, I mean, the government is working with Moderna and Pfizer to find out as they continue trials and as they continue to get data, if that's an actual precautionary issue or if we can start doing those things. So right now we're kind of held back by that. But again,
Or
like
we
Doc
use a
said, we
different
do have the
vaccine.
plans. Right. Right.
Or some of the other vaccines come out where that is more of an option. But we absolutely would love to take vaccines right into people's homes when they're not mobile. Yeah.
Yeah, and we've got the groups required to do that on our conference calls every week. So we are ready to pull that trigger as it's available.
All right. The next question, this person is wondering if our low numbers are keeping the vaccine to be delegated to our area.
No, the vaccine's being allocated kind of through populations, based on population, and the other was based on our essential workforce. So not based on our COVID numbers.
Wants to know, are you getting the vaccine for second doses as they have been scheduled?
Yes, we are.
A lot of, again, repeat questions about the time on Friday. And then again, the second shot, are we guaranteed our second shot on time?
So this is what we're hearing from the state, that they do, we have to order vaccine weekly based on a first dose or a second dose allocation. And they will fill the second dose allocations preferentially. And then what's left, they will reallocate through the first doses. So what might happen is for a while, the first doses may go down as we make sure the second doses get finished. If the vaccine allocations stay scarce the way they are now. So a lot depends on how much vaccine starts coming into the state and how we do it. But the state is very committed, from our understanding, of making sure that when we ask for so many second doses, that they will prioritize those orders. Now, does it matter if you get your second dose on day 28 as opposed to day 32 or 35? Probably not. Okay. So, we don't have to have this down to the day. We don't want to do the intervals any sooner, and we certainly don't want to extend it out too far. We want to get people done as quickly as possible so you can say, I'm fully immunized, right? We know that's important. But please understand that if you don't get your second dose on day 28, that something is going to go wrong with your process. It will count. And I'm only saying that because I just, you can see what's happening all over the state, all over the country. This is a logistic nightmare. The logistics of getting this vaccine out and into people's arms is astoundingly complex. And so if something happens and you get in a week later, please don't worry. Please don't worry about that. It's going to be okay.
Great. Thank you. All right. Have you notified volunteers if they are on the list? I'm registered with Michigan Volunteer Registry and have a current RN license.
Oh
Yeah.
boy, that's a Liz question, my nursing director, who has been pulling volunteers from that list as needed for the. I don't know if we've done all of them though. Justin, do you know if we've checked in all of them?
I can speak to that. We probably haven't used them all, but I know we did pull some for one of the hospital systems in the area to help one of their clinics this week or next week. We are actively pulling people off that list. And on my staff, our volunteer person she's managing all of that for us. And if you haven't gotten a call yet, just stand by because you will get a call.
Yeah, stand by. And remember, we really haven't launched any of these large-scale vaccine clinics yet because we haven't had the vaccine volume to do it. So we've been managing pretty well with our staff and with a handful of volunteers. But we know that's going to change as soon as the vaccine opens up.
Okay. If you register with the healthcare facility like McLaren, should you also register with the health department too?
Probably, yeah. Honestly, I don't know how these allocations are going to flow into those systems. I don't know if they're going to vaccinate everyone that's registered or are going to limit it to, for instance, their patient population if they're already in their system. I just don't really have all the answers for you. So if you have opportunities to register or get on a waiting list, I don't see any harm in doing that in multiple places. They will, almost every system will ask you if you've been vaccinated anywhere else and ask you to pull yourself out of those lists once you have received one.
Okay.
I'm sure there'll be a system for that.
This person, I missed her question earlier, but she said she has patient contact and the appointment scheduling was only 65 plus. So how does she get a vaccine? And then someone else said they also were a healthcare worker who can't get an appointment. Can you explain the closed pods kind of?
Oh, with us?
Yeah.
Okay, so with us, our open clinics on our website are for 65 and older, and you're right, they're very limited. If you are a healthcare worker and one of these essentials, and you don't work for an employer, because I think we've kind of contacted all the employers, maybe we missed some. You're going to have to let us know that. Send that information through our COVID-19 at stclaircounty.org. Give us your situation, and we'll get you into one of our closed pods. Our essential workers, 1As and 1Bs, are being offered a clinic separately. They're still limited as well. We can't, but they are provided a scheduler that's different, and usually it's even on a different day. So we do some of the clinics on one day, and then we do a different group on a different day. So if you're in that situation and you're actually a essential worker that we've missed, yeah, you got to let us know, please, so we can get you started. We do have a waiting list for that. We have a whole folder for essential workers that we work through every time we open up a clinic. We work through and send them out. So in a way, we do have a waiting list. It's just not for the general public. So I guess I'm trying to defend myself.
Someone wants to know what information do we need to make an appointment online? So when they make the appointment, I think she's asking, what do they need to include?
I'm a deer in the headlights. I'm not sure.
Yeah, like telephone number, contact information, name and age for certain clinics. It's not. It doesn't get super intensive. It's just enough information for us to contact you and make sure you fit into one of the groups.
And an email address.
Correct.
Also.
Yeah.
Name, phone number, email, no demographics.
I think zip code, maybe. I can't remember
Birthday,
off the top of my head.
zip code.
Yeah, birthday.
It's really basic. Yeah.
Yeah, it's pretty basic.
Yeah, there's no life history issues.
We don't need your health insurance information or your health information or anything like that.
This person said, by the time the vaccines can be given to the last group of people with mutation of this gene, will the current vaccines even be effective? Yeah.
So far, yes.
That's a concern. But so far, the feeling is that the mutations that we're seeing are not going to impact the effectiveness of the vaccine.
And that's just because of the way the vaccine is made, right? It's made to attack the outer protein shell, the spiked proteins. And then once you take that away, then the virus will die. So that your body can fight it off. So that's what's happening.
The mutations actually affect just single amino acids. And amino acids are the building blocks of the full protein. So if you get a mutation that affects one or two amino acids, it still doesn't affect the entire protein in a way that can't be recognized by your immune system. So it is possible for a mutation to change enough where it may not, but we're not seeing it to this time. And I don't think in the near future we're going to have any problems with the current vaccines. It is possible that the vaccine will have to be changed and people will need some type of booster. But at this point, it's not a concern. It's a good question.
Go ahead. Okay. Is there any evidence that vaccination will prevent you from having serious illness?
Oh yeah, absolutely. That's absolutely what the vaccines have been. The ones that we have been proven to show. It prevents serious illness and it prevents actual illness, being sick in itself. What we don't have definitive proof of right now is whether or not it prevents asymptomatic infection and thus the transmission of the virus in people who don't have symptoms. The studies are not there yet for us to assume that. So that's why we say even after vaccination, you still need to mask and keep that physical distancing strategies intact, because it's not clear whether the vaccine will protect you from giving somebody else the virus.
Okay. Next question. Do you know if Annette County Health Department will vaccinate people from St. Clair County? And then someone wants to know, do you have to live in the county that you to get vaccinated as well?
Yeah, I talked to Bryant Wilkie, and we both agreed that we're very eager to vaccinate our populations. We know our populations work and play and go back and forth quite a bit. So it is not a strict criteria to live in one county and be vaccinated there. We encourage it because we talked about how the state's currently allocating vaccine based on population. So if a bunch of people from one county went to another county, you'd be theoretically taking vaccine away from those people. But as far as Sand Lac and St. Clair County go, we're happy to vaccinate each other's people. If things are more available here versus there shouldn't be a problem. We're requesting people to stay and to follow the rules, but we're not requiring ID at the time of vaccination. So we're just taking people at their word that they're from our community before we vaccinate them.
When the chronic conditions group is able to make appointments, do we need proof from our doctor with a diagnosis list or an RX from them?
That's a really great question. And I'll be honest with you, we haven't fully worked this out. I was just talking to the docs last week or this week about that. And I think they're going to be very helpful in identifying the patients who would benefit the most from the vaccine when we get into that age group. I don't have an answer for you. Here's my thought. I don't want to deny vaccine. I want as many people to be vaccinated as possible. And I don't want to be the judge of one person's healthcare problem being more or less severe than another person's healthcare problem. Or maybe you don't have the ability to see a doctor and you can't get a doctor's note. And to me, that would be a really significant barrier to vaccinating people who really need it. So I can't tell you exactly what the policy is going to be, but I would have to say, no, I don't think you're going to need a doctor's note to get vaccinated. I think that would be too high of a bar, quite honestly.
Okay. This person says, thank you for all of your hard work in starting the vaccinations of our teachers and staff. Will you be taking the teachers and staff that work face-to-face with the students first instead of virtual educators?
Yes.
I'll take that one.
Go ahead. Yeah.
So we have worked with all of the public school and private school leadership in the county to create a priority list. And we understand, such caregivers or teachers such as, anyway, the teacher groups, I'm missing it on that right now. But yes, there is a priority list for like special education is what I was looking for. And other contact staff that may be at a higher risk than others. We have that list. We've worked with them, and we are all ready to move out on that.
Okay. Somebody just is questioning our appointment system again, but they want to know, why are the appointment times set up where multiple can be in the same appointment time trying to get it? That this person, and we've heard this before as well, had entered all their elderly mother's information into an appointment time. They hit submit, and then the time was no longer available.
Yeah, I appreciate your frustration. Well, there's multiple times because we have multiple stations. So the more vaccine we have to distribute, the more staff we put out, the more vaccinators are there. And so you can vaccinate so many people every 15 minutes. And our staff has got that all worked out, what they can move through. No, I agree. It's not a perfect system, and we're going to have to continue to work with it. I'm trying to remember the question now.
Yeah,
I'm sorry, I lost the gist of the question.
This is just, you can tell we've been doing this a long time. So basically, we're just in a unique time right now where the demand is not, we're not able to meet the demand. So please continue to try and submit. We're not trying to frustrate you with the process. But we are very limited at this point. And as we get less limited, we will be the first people to get on here and tell you so.
And if you could just lastly, because pretty much we're done, lastly, just differentiate between like the 65 and older, that's where the link is going to be on our website versus in the closed clinics that aren't open to the public, those people will get different links in a different way.
Correct.
Can you just
And if you
reiterate that
think
a
we've
little bit?
missed you, if you think we've missed you because you're an essential worker, you need to let us know that. But the 65 and older are delegated to that general online site that is frustrating so many people. You know, it's only frustrating because it's just there's not enough appointments there, and we know that.
Right.
So we're going to keep working to expand that, and the more appointments that are there, I think, and that's how we're going to know we're ready to move on. Quite honestly, is we start opening up clinics and we don't fill them in a day's time. I think we're going to end up seeing, moving on to some of these other priority areas. So,
Okay, so can you just go over the website again for those people
So
right now, 65 and older?
SCC www.scchealth.co. It should be right there. Schedule an appointment. Look on Friday, no sooner than 2:00, and no later than 4:00. But I hate to say that, and I know people are going to refresh and go, but you can get your appointment. Next week, we should be able to provide some type of call-in option, and we should be able to provide as well some kind of waiting list option. So if you don't get an appointment and you just want us to know that you're there and you exist and you want a vaccine, we'll have that available. Now, if you get on that waiting list, it doesn't mean we're going to call you back next week, right? We're going to have to just kind of work our way through as the vaccine becomes available. But that those two improvements are coming, and we just appreciate all your patience. Thank you.
Just to note that website that Russ just put up on the screen there is incorrect. It's scchealth.co. Just to let everybody know. Okay, I just noticed that.
I bet he'll fix it real quick.
Okay, great. All right, and lastly, just again with closing comments and everyone's patience, just hang in there. But Justin, take it away, closing comments.
I'll go first. Yeah, we got some good news here. Our rates are starting to come down. Our hospital systems are in good shape. We're all like COVID weary, but we're COVID warriors, right? We know, we understand the process. We got through the holidays, and everybody is still loving and intact. I think, we can do this. The vaccine piece is frustrating, but it is still the light at the end of the tunnel, and we just have to work our way towards it. And I'll just say that we are, as a health department, very committed to being as fair and equitable with this process as we can. And we know that people get through. I can't help people who figure out ways around the systems. I said this last week, we could tighten things up so hard that nobody could cheat and nobody could get through. And all that would do is restrict a lot of people from getting vaccines that needed it. So we're asking you not only to be patient, but to follow our recommendations, to follow our rules. We'll get to you. And every time somebody cheats, it's taking away a vaccine from somebody who really needs it, probably a little bit more. So let's try and be kind to our neighbors and kind of consider that as we go through this process. Okay, thanks.
And so there's one thing I want to just make sure people remember. If you need to be in one of those closed pods, such as essential health workers, et cetera, and you are not, please email covid19@stclaircounty.org to make sure we get you into the right spot. Just wanted to reiterate that because I saw a couple more questions. So in final, obviously, it continues to be a little bit trying to get the number of vaccines we need in our community. And as Doc said, we're asking and begging for your patience as we work through this process. Just know that our staffs, both the health department and emergency management, are working around the clock to make sure that, one, we have the vaccine available to take care of the entire community, and two, we have the ability to put the vaccines in arms. And I assure all of you that those plans are solid, they're there, and we're ready to roll just as we have been the last couple weeks. So I thank you all for watching today, and I appreciate everything the community is doing, from all of our essential workers, restaurant workers, first responders, everybody that's doing what they need to do to help the community make it through. Thank you all, and I will see you next week.